Make sure you don't drive for the next 24 hours or while taking the prescription pain medicine, and we ask that someone stays with you for the next 24 hours for your safety. You'll want to sleep with your head elevated for at 30 to 45 degree angles for the next 10 days. That helps reduce swelling and bruising. And you can resume all your regularly prescribed medications after surgery. Make sure you have easy foods for the next 2 days.
Make sure I have what?
Like easy bland foods, healthy, fiber rich. Ginger ale is okay. Nothing too greasy or spicy, and stay well hydrated. The lift goggles, speed healing. They help reduce swelling and bruising and help keep your wounds healing well.
What does it?
The lift goggles that you're wearing right now.
Oh, okay.
So for the next 2 days, you want to avoid getting the your wounds wet. A bath is okay after 24 hours if you keep your neck up dry. Don't pick, push, or rub your wounds. Make sure they're healing okay. They are going to be weak for the next few weeks while they're healing. Again, keep those incisions clean and dry. You might seep some fluid, blood for the next couple hours. That's okay. Your lift goggles, we're going to go over those too.
My what?
The goggles you're wearing. You're going to want to wear those constantly for the next 2 to 3 days. Preferably 80 to 90% of the time that you're awake, you're going to want to keep those on. The only time we want you to remove that is if you're feeding yourself, walking around, or using the restroom, and just some short rest breaks, so about 15 to 30 minutes at a time for a few times a day. And then to perform any application of ointments or cleaning. But you're going to want to wear those while you're sleeping for the next 3 to 7 nights.
Okay, you're going to give me the information about the ointment?
We're gonna get to that. Yep.
Okay.
If for any reason you have to discontinue those goggles, you have to switch over to the cold and warm compresses, and we'll go over that too. Goggles, they should be tight enough to have mild firm pressure, but not tight enough to give you a headache or cause any pain. If you would like to, you could put a 4x4 pad under the goggles with some balm applied to help with comfort.
You mean like here?
Under them?
You've got some pads there already, which
Can you see my pads?
No, they're under the goggles, though. I was going to ask, are the pads under the goggles right now?
yeah, I
Okay.
see one on this side over here.
Does she leave those in?
We'll go over that.
Okay.
But yeah.
We'll get mad over it.
Otherwise, I wouldn't be walking around like this.
So if you're not gonna wear the lift goggles, you need to apply a
Well,
cold
I am going
compress.
to wear them.
Right. Yeah.
That's why I got them.
Yeah. So there are directions here. For some reason, those don't work out for you. You'll have to do the cold compresses 30 minutes every hour. And you can use ice packs, frozen vegetables. Just make sure you use a clean, protective, minimally wet barrier between the cold compress and your skin. After 2 days, you can shower. Just make sure you don't rub those wounds. You can blot dry and just let the water soap run over the wounds. So Dr. Burrows instructs you to apply any antibiotic ointment to your eyes.
Yes, I guess that's the prescription I have, right?
Yep, so if he told you to do that, you're going to do that twice a day. After 2 days, so after 48 hours, you're going to start applying that. If that runs out, you can switch over to Vaseline or an oil-based balm for the first 10 days. And anything longer than the 10 days just helps with healing and comfort. So your activity restrictions, you can't bend, strain, perform strenuous activities, so that includes lifting anything over 15 pounds for at least 10 days. You can walk gently to help with healing and reduce dangerous blood clots. Do you wear any contacts? You need to wear large sunglasses in the sunlight to help with light sensitivity, and always use a sunblock of at least 30 over your incisions for 3 months. Again, don't drive or drink alcohol.
What did you just say just now before that about the 3 months?
You need to wear a sunblock of at least 30 SPF
On what?
over your incisions. Don't drive or drink alcohol while taking prescription narcotic pain medicine. You can expect mild discomfort for a few days, especially around your brow and outer bony soreness. You can expect your eyes to be sensitive and your vision will be blurry. You can use preservative-free artificial tears or the gel tears, which are called sustained gel, as often as needed, or ointment 2 to 3 times a day. If you do use the eye ointment, that will blur your vision, but it does help with the irritation that you might feel. If you had lower eyelid fat removed, he wants to use gel tears instead of the ointment.
I have what?
If you had eyelid fat removed,
I don't know what it is.
No, she's good. I just wanted to let her
When can it open my eyes?
Yeah.
You want to try again? Yeah.
well, you're gonna wear those goggles. You can't really see through those goggles.
But I feel like my eyes are taped now. Are they taped?
So you've got some gauze here on your left, I see. I'm not sure if you have it on your right. Even when you open your eyes, they are gonna be blurry. So,
Right now I can't see anything.
yeah, you can't see anything through the goggles. And once you go outside, you're gonna want to put the goggles on because you should wear some sun protection on your eyes.
For how long?
We need 2 more. Is that okay?
For as long as you can.
Didn't it say 48 hours to keep the goggles on for 48 hours?
She said 2 to 3 days.
Yeah,
Yeah, it's all on paper for you.
yeah, just leave those goggles on as much as possible. You can take a little break every now and then.
Right.
Those goggles are really special,
Yeah, those are big goggles.
and they're good looking.
Well, I'll see when I see your photo, when you send me the photograph,
Okay,
and when I can see.
yes. You will be a little bit dependent on everybody around you for a while.
So you might have some trouble closing your eyes, especially at night. Usually the gel drops or ointment into your eyes before bed can help with that for the first week. You can also expect crusty, gummy eyes for a few weeks, and you can use the warm, very wet compresses for twice daily.
The warm one?
One to the right.
You can switch from the cold compresses to the warm compresses after 2 days to help with comfort. Again, you just want to blot dry. Don't rub any part of your eye. Once you start healing, your eyelids will feel itchy, numb. They can feel tight for up to 3+ months after surgery, and that's to be expected.
They can feel what? Tight? Is that what you said?
Right. Yep. Numb, itchy. And if you have dissolvable sutures, those will fall out in 2 to 3 weeks. Otherwise, permanent sutures will be removed usually after 7 to 10 days, but sometimes they're left in longer, and that's up for Dr. Burrows to decide. Awesome. Don't wear any makeup over your sutures. It is okay if you notice swelling and bruising for the next few weeks. That rarely happens for a few months, and it's really rare for you to see that for up to a year. And the healing process is gradual, though. Scars can remain highly visible, red, discolored, and raised for months and improve for up to a year. Noticeable improvements will begin at 3 months. So you'll get a handout with Dr. Burrows' number. you can call for any questions or concerns. Some things to watch out for if you notice severe, rapidly worsening swelling and bruising. You'll want to reach out to his office. However, swelling usually just progresses normally, kind of slowly and gradually, and it's worse tomorrow morning and then the following morning after that. So two rough mornings of that swelling. If you experience a high fever over 101 degrees and nausea or vomiting that doesn't go away, dizziness, hallucinations, anything of that nature, give him a call. If you notice bright red skin that's hot to touch, uncomfortable, if the redness gets worse, or if it's later.
When you say the skin, you just mean up here, right?
On your eyes, yeah. Yep. And any redness later than day 4. Discharge or any foul smelling discharge, give him a call. Excessive bleeding that doesn't stop after applying pressure or elevating your head for 10 to 15
And you're giving
minutes.
all of this to
It's all on
Bridget?
paper. You got
Yes.
it. Yep. Give him a call if you notice excessive bleeding or pressure that doesn't stop after elevation for 10 to 15 minutes. But you can expect some bloody discharge for a few days. Any pain that doesn't go away or isn't controlled well with your pain medicine. And this just mentions again that you can expect blurriness, and that's okay.
Okay, going home in the car, if the seat goes back, how high do you have to be elevated?
You wanna go stay at least halfway up. So if you can sit upright in the car, I probably would.
Sit upright?
Yeah.
Well, recline it some, but not
Yeah.
all the way.
Okay. You want your head elevated at least 30 to 45 degrees for 10 days when you're sleeping. Okay?
Mhm.
So that's about halfway from sitting upright. That's what that means.
Mhm.
Alright, so Joy probably gave you some gauze in your, I'm gonna take a look here.
Oh, sorry. Otto,
Okay.
come on, move over here,
You're
honey.
such a good boy, I
Come
forgot
on.
you was even here.
Good boy. Sit down. Sit down, Mushka.
So these are the gauze pads.
Down, down.
They're gonna be in your goggle box. So Joey gave you a few of those. So you can switch those out if you need to, and then you've got a pillow here too. Alright, so is it Bridget?
Bridget, yes.
I want to have you sign some paperwork.